Well, good afternoon, everyone, and thank you for joining our session this afternoon. My name is Howard Genderson, and I lead business development and strategy for Indegene's emerging biotech business unit. That's their unit that supports small businesses looking to commercialize. And it's my pleasure today to introduce our session this afternoon, how bidirectional data flow between the sales force and marketing can improve and impact your launch results. And we're fortunate today to have the Chief Strategy and Performance Officer at Therapeutics MD, Mitchell Crazen. And Mitch, I'll ask you to spend a second, introduce yourself and the topic, and we look forward to hearing your comments today. Thanks.
Great. Thank you. I'm Mitchell Crazen. I'm Therapeutics MD. We're a women's healthcare company. We've been there about 11 years, and in that time, we've developed 2 products that got approved by the FDA and licensed another product in birth control. So we have products going from prenatal vitamins, menopause, and birth control. And we've launched 3 products in the last 3 years. So I want to discuss how a disciplined approach to using data, I believe, helped us launch our first product in Vexi for vulvovaginal atrophy in the marketplace. So can I share my screen now? And welcome everyone. And the case study I want to go over today is how multi-directional information can really help you drive success in a launch. The first thing I want to do is discuss what the market conditions were at the time of launch. So it was a relatively inexpensive product that we launched at $200 WAC. It was a branded market with 3 established brands dominating the market and 2 new brands that had just come into the market. We believed generics were going to enter the market in the next 12 months, and 2 did, which for 2 of the established brands. And overall, the condition is very undertreated, and compliance was a major issue in the market. As with any launch of a new product, we knew that the key was to get a core group of doctors writing as quickly as possible. We started with a fairly traditional approach using both quantitative and qualitative primary research of both physicians and patients, as well as prescriber level data from Symphony and IQVIA. What we did a little differently was we added on diagnosis codes that acted as a surrogate to determine which doctors had the most opportunity to prescribe beyond looking at just the past prescribing patterns, because it was an underserved market. The second thing we did, which was the most impactful, is we captured data from the sales force on a subset of prescribers that we would use to micro-target at launch and develop personas for non-personal marketing. As you go to this next slide, what we did during pre-launch, what we asked the sales force to do was for 20 to 25 doctors from their overall target list, we asked them to get certain information. What was the access in the office protocol look like? We wanted to confirm the market opportunity in the office. And we also allowed the reps to give their own perspective. Was this market in that office underutilized or overutilized? Were they prescribing more than their fair share or less than? We also wanted them to understand the doctor's view on the treatment of the condition and how they diagnosed. Was it treated proactively or reactively? What was the doctor's level of satisfaction with the existing products in the marketplace? Did they currently like the options available, or did they feel with a better option there was an unmet need to expand treatment? Again, we said this was an undertreated category. So going on to the next slide, once we had all that information, what is it that we did with it? Well, first is we helped the reps determine what 10 doctors they were going to micro-target at launch. And we reviewed this data and rationale with them and the managers to get buy-in of what they wanted to do. The next thing we did, and this diagram shows what we called it was our Experience First program, which was a combination of sample, data, or sample, education, and patient support to get a doctor to write their first script. So when we rolled this program out to these micro targets, there were very specific steps that the reps had to follow. And as is indicated in the blue on this slide, every step along the way, there was either data that the rep provided or that we provided back to the data that we were able to track along the way. Going on to the next slide, one of the most important components of the EFA program was tracking and reporting on the results every step along the way, and as on a close to a real-time basis as possible. We had information updated every 24 hours. We tracked how many doctors each rep targeted, how many doctors signed up to participate in the program and received the EFP kits, how many kits were initiated with the patients, and how many of those patients went on to fill and refill those prescriptions. These results were tracked and shared with the reps and the appropriate people throughout the company. What this did is it provided great motivation for the reps and others to say this was working. The other piece that happened is it provided instant feedback to the reps. So they knew, was their messaging resonating with the doctors, and were the doctors taking action? This immediate feedback isn't always available, and it reinforced that behavior to stay focused on these targets and really do pull through. What was interesting in creating this micro targeting list, it wasn't necessarily going after the highest decile writers. It wasn't just, all right, here are your 9s and 10s, go get as many of them as you can. We really looked at those doctors that we can impact quickly and get those writing. And what we found is most of these doctors fit in the persona we called ready, willing, and able. And as I said, the next role that happened with this data is we were able to better put all the doctors in personas, which allowed marketing to create very personalized marketing messages. And we came up with 5 personas. An example, one of the personas, which I mentioned already, was ready, willing, and able. What did this doctor look like? This doctor believed that the condition should be treated proactively, and they were treating proactively. They were comfortable with using estrogen to treat the condition. They weren't overly satisfied with the existing options. And placing each of these doctors into we had 40,000, both those that were called on in white space, allowed us to personalize and properly sequence the information for these doctors. The next slide shows just an illustration of what we did with one of the campaigns. This was our email campaign, and we had 14 different emails, both on condition awareness and specific attributes about the product. We put all the 40,000 doctors in their persona based on either the information that the reps provided, which was for roughly about 3,000 of the doctors, and the remainders, we used that data as a surrogate and look back at the information we had on the doctor, put all the others into an appropriate persona, and then we emailed the campaign. Again, tracking results was really critical. And this is just an illustration of some of the information we tracked. But when we looked at those doctors that the reps gave sales information on, they really completed the survey information. We had 17% open rates on the email campaign, which is incredible. Now, for those that we extrapolated the personas, we still did better than industry average with open rates of about 7%. So we were really happy with that program. At the end of the day, one of the things that we think matters is results. What are the prescriptions doing? And we think having this very disciplined approach allowed us to get the results we want. So on slide here, we're showing the results of Imvexxy compared to the competing products in the market. Vagifem is one of the established markets. It launched in 2002. And as you can see, the Imvexxy launch mirrored the success of the Vagifem launch when there was really only 2 other products in the marketplace. When we compare that to the other 2 lines below, the green and the purplish line, those are 2 new products, Inarosa and Osphena, that launched 12 months prior to Imvexxy. And compared to those, we did 200 to 300% better on a monthly basis. And really, at that point, we had established a 10% market share in 12 months of the launch. So what we believe is by taking this very disciplined approach, it helped. And what did this do? We had over 50% pull through of those targets who were in the EFP program. We also then quickly got another 10,000 doctors writing in the first 12 months. And by being very connected, both the doctor and the patient through the programs we did, our compliance rate was far better than the other products in the category, both in refills along the way. That combination of items really allowed us to drive results in the marketplace. We think much more superior results than the recent history in the marketplace. Going on to the next, we didn't do everything right. We had lots of learnings, but being very disciplined to the data allowed us to react and continue to adjust what we did. First, I think what we should have done is required our sales force to do this survey on more than the 20 doctors. Keeping it as an ongoing program, we would have had better data on how we move doctors and be able to better personalize the additional campaigns. The other piece of area that I don't think we did a great job of, we weren't really ready for add-on campaigns on non-personal level beyond the initial email campaign. We really needed to be prepared to adjust and move with multiple personas based on what was happening in the marketplace along the way. So this is kind of the quick overview of what we did along the way using data. I'd like to go back to the slide here, which really shows the data that the flow of the data. And this discipline approach, I believe, really helped. We started a pre-launch. We introduced the product to the doctor. We told them about the EFP program. We got them to sign up for it. And we had them sign just like it was a sample signature. So it brought in that commitment. And we didn't just drop the packages off and say, go ahead. We had them commit that they wanted to participate. Each doctor was allowed to get about 10 kits, but we didn't deliver them all at once. We wanted to make sure we saw a pull through, and we allowed reps, if one of the selections wasn't successful, to have a backup. So we didn't waste kits that just sat in an office. The second was education materials for the patient, so they knew exactly what they were getting. The third piece was, once it was prescribed, was really strong follow-up and patient support, so the patient was able to get on therapy, stay on therapy, and receive it on an ongoing basis, because VVA is a chronic progressive condition and the therapy is used weekly and goes on. Then, to make sure people were happy with it, was the follow-up back with the doctor and the patient. So when you look at this slide, you see all the components, and this data to see the success and where things failed was tracked really closely throughout the process. So, I ran through this really quickly. Hopefully we have some questions and we can dig in further on what interests people on what we either did successfully, how we executed it, or things that we wish we would have done differently. So I'll turn it back to Howard for some questions.
Yeah, thanks, Mitch. And it was really great presentation and impressive results. We do have some questions, but I would encourage the audience to please use the chat function and share any questions that they might have. Mitch, the first one to ask is, you had a really high compliance rate, a lot of success there. What do you think drove that? Was it something with the program, or operationally, or something with the product? Do you have a perspective on that?
One of the things we do differently as a company is we have our own customer service hub in-house called VitaCare Prescription Services. It doesn't fill any prescriptions. It just helps make sure that the person gets signed up for any copay assistance, that is covered by their insurance, that is available at the pharmacy they want it at, or arranged for home delivery. And it stays on top of that, so there's no surprises, particularly at a launch when there's limited coverage, where it's not always in stocks, people don't know about it, so they come up with excuses. Oh, I can't find that, it must be a discontinued product. All the reasons why it doesn't get filled. And the other byproduct of that is, when it doesn't get filled, it gets feedback to the doctor, which then stops writing new prescriptions. So our services hub was a big component on getting that filled, which was staying in direct contact, both on initial fills, subsequent fills, and any issues that a patient had along the way.
Sure, it makes a lot of sense. I appreciate, sharing the successes, but also some opportunities to sort of do better the next time. And one of the things you mentioned was the inability for add-ons. With what's available with technology today at the end of 21 going into the future, as you're redesigning, what other things would you want to have in your universe of data to be able to omni, if you will, as you're working through the a program like this, thinking about a new one?
Um, when you look at this item, you can look at prescribing. But what we saw was a lot of success with doctors who had the patient population. It was almost, they had the women in the age group 45 to 60 that we were focused on, or 65, but they were under treating the category. So by using just prescription data, we were short. And what we also found with this condition is even when they did prescribe, they really didn't use the diagnosis code because it was part of the annual exam. So we really had to look at other bits of data around annual exams, around pap smears, around surrogate information to say, you know what, this doctor is seeing the patients regularly enough, but they're not treating. And then let the rep go in and figure out why they weren't treating, and then follow them up with the importance of treating the condition. So when someone was in that mode, we really hit them with disease education. Then we followed up with product information. So, and we did that mainly through email. I think if you can broaden that to other mediums, that will be really helpful to keep reinforcing that message continually.
Sure, that makes sense. Sort of on that line of other channels, there was a question from the audience on overwhelming the rep. So there was a lot of positive feedback from the rep about seeing results, but did you guys balance the idea of too much information, and what was the rep juggling, and how many sort of inputs? Maybe if you could share a little bit of that, or demystify it, make it simpler for us, that'd be great.
Yeah. What we did is we kept it pretty simple. The reps had a performance screen that showed the sample and push through. The survey that we did, what was interesting is there was a big difference between the reps' view of it and the manager's view of what we did. And one of the steps along the way that created a lot of controversy with the managers was having the rep go in and have the doctor sign for participation and then go back a second time and deliver the samples. Everyone came back and said, why you do that? We can just do it all at once. And it's simple. You're making us do more work. When we went back and looked at it, the reps came back and said, oh my God, that worked great, because it really got us buy-in and gave us another reason to come back and reinforce with the office. We did it with another program, and the sales was successful at not having that step along the way and did not perform as well. So that was one of the examples. So it's really keeping it saying, does the step add value to it? Now, the other, we asked, it was about 15 questions in the survey, and it wasn't that the rep was supposed to go and sit in front of the doctor and ask the questions. It was about the conversation that they were supposed to have and uncover what are their objectives or hot buttons. What was interesting, you could also track every one of those questions to one of the pages in the detail aid. So if someone said, I just wait till the woman complains about it, there's a spot in condition awareness that explained that women weren't even aware this was related to menopause. So if you didn't bring it up, it was a problem. If someone said, I hate the other products, they're messy, you could go straight to product attributes. So the questions really help drive the reps to what was the best messaging to give, given that the doctor's response. And it was supposed to be done over time. Be aware of that. And then the benefit of marketing to be able to continue to refine was really strong.
Sure. That's great. So just for the audience, we're going to do two more questions, and then we'll get close to wrapping to make sure that we're on time. But you mentioned, just interestingly, the phrase controversy, reps and managers, and tracking. And I'm just curious, was there any big brother feedback or any concern early on about what they're going to know? There's so much information being gathered and shared, and through digital channels and rep and all of the different platforms, and lots of conversations about sort of how who's looking over whose shoulder. I'm wondering how I saw once results happen, people were in, but in the beginning, were there concerns, and how did you overcome those?
We started with one simple dashboard, and we had an example of it in the presentation, which just showed the flow that we wanted them to do. And then we had everyone from senior management on down to the rep use that one dashboard for basically 2 months, which was the length of the program, and stay focused on that and not say go everywhere else. This is what our commitment was. Stay focused on it. One of the things that we also didn't do well is as we added more information as they went through the regular routine of doctors, you needed to simplify that. It's all right. Now this is the next step. Let's not keep adding more and more data on you. It's really important to have them look at for periods of time, whether it's a quarter, 6 months, a simplified view of data that you really want them to drive and focus on every morning.
Perfect. Well, I appreciate that. I'm going to give you the last word as to sort of where we're all going into the future. Things that have been evolving in this space in marketing and data and information well before COVID, and certainly accelerated into new areas. What is your anticipation for what's going to be the hottest trend in the next thing this time next year when we're at the summit? What will we be talking about? What do you anticipate and looking forward to?
I think the role of the sales rep is changing, and I think COVID accelerated that with their ability, with what the type of access is. And one of the challenges is getting what's in the rep's mind and what they see in the field on a doctor by doctor basis into your data sets, so we can give them better information to better message and timely message to the doctor, as well as now reinforce that frequency that they're not able to get through all the other means, and do it in a coordinated fashion. I look at it as with, whether it's Amazon or any other company, we get bombarded with ads in our email, on our phone, and everywhere else. And as long as it's changing and informative, you don't mind it. If you see the exact same thing every day, you kind of tune it out. And we have to think about that with the rep interaction and the other interaction we're doing with them, that it's interesting and valuable and changing to the doctor. So it's not, I saw that 80 times, I'm sick of seeing it. And I think that's a little bit of a different mindset. And so I think that's going to be something changing in the future, treating doctors as consumers in that way.
Sure. Yeah, really good insight, and I appreciate it. And Mitch, I appreciate you and your time today and sharing your thoughts and the case study and some of your insights with the audience. And I'll thank everybody online who participated. Appreciate your time. We'll end this session now. We'll hope everybody sticks around for the next session, looking at emergency use authorization, and then our final keynote to wrap our summit later today. So Mitch, thanks very much.
Thank you.